Okay, this is going to be the mechanics of breathing, something you do every day. You breathe in and breathe out, and all you have to do is repeat that. So if you look over here, it says inspiration or inhalation, they mean exactly the same thing, is when gases flow into the lungs. Expiration is when gases flow out of the lungs. So the gases that they're talking about are oxygen and nitrogen and everything else that makes up the air that you breathe. So breathing itself is going to be mostly done with the diaphragm. The diaphragm is a dome-shaped muscle, and when it flattens, it's going to cause air to come into your lungs. If you are doing heavy breathing like exercising, you're going to activate some of the other muscles that are considered to be accessory muscles. For example, if you look at here, it says the scalenes, the sternocleidomastoid and the pectoralis minor, all because they attach to either the rib cage or something attached to the rib cage. The erector spinae muscles also will help to straighten your curvature of your back so that you can get more air in. So this sequence here kind of tells you everything that happens. Under inhalation, which is this top portion, and they list it as inspiration, you are going to have your diaphragm drop. So the diaphragm will descend, the rib cage will rise, and as that happens, the thoracic cavity volume will increase. The lungs are being stretched. Your lungs don't like to be stretched, so basically what's going to happen is they are reflexively going to recoil, and that's going to be exhalation. But inspiration or inhalation, diaphragm drops, the thoracic cavity increases, the lungs are stretched, and the intrapulmonary volume will increase. The intrapulmonary pressure drops to about -1 millimeters of mercury, and the air will flow into your lungs. And if you look over here at this side, you can see as you're inhaling, your external intercostals will contract. The easiest way that I found to remember it is the I word of inhalation or inspiration uses the E muscle of the intercostals. So I, inspiration, uses the external intercostals. Exhaling is a reflex. So as your ribs are stretched or your lungs are stretched, they want to go down to its smallest size possible. So the inspiratory muscles here will relax. When that happens, the diaphragm will rise back up. So rather than being a dome shape again and flattening out, it'll go back to its dome shape type of arrangement. When that happens, the thoracic cavity volume will decrease. The elastic lungs will recoil passively. Usually I take a rubber band, and if I stretch it and let go of it, the rubber band will go back to its normal smallest size. Your lungs do the same thing. It basically, as you are exhaling, the lungs will lose the air that's in there, and they'll reflexively go back to their smallest size. The intrapulmonary pressure will rise again up to +1 millimeters of mercury, and the air gases will flow out of your lungs through a pressure gradient until it's back to 0. So you're breathing in, the diaphragm drops down. You're breathing out, the diaphragm goes back up, and the lungs get back to smaller. One of the things that you got as part of your class lab stuff is the kit from Carolina. And we're going to talk about that in a couple minutes. So the best thing that I can tell you is this chart here. And so what Carolina sent you as a part of your lab kit is going to be a spirometer. A spirometer has the ability to test your ability to force your breath out, and it's actually used to test people who have asthma. So if you look at this chart here, in the blue is everything going to be inhaling. So as you take a breath in and out and in and out, the sine wave will go up and down. So we're going to go in and out and in and out and in and out and in and out. Tidal volume is going to be the anatomical definition for breathing. under resting conditions. So if you're sitting at home, not doing nothing but breathing in and breathing out, you're breathing in and breathing out, you're really not stretching your lungs all the way up to here, and you're not trying to blow it out. So this center blue line is called tidal volume, and it's about half a liter of volume of amount of air that you get in on any time. When you look at this, it goes in, it goes up, and then as you go to the top of your tidal volume and take more in as much as you can, that is one of the first IRVs. There's two IRVs that we're going to talk about. The first one is called inspiratory reserve volume, IRV. It's about 3 liters. So breathe in, breathe out, breathe in, and then you're going to take that extra amount that you can get in to totally fill up your lungs. That is called the inspiratory reserve volume. Then as you breathe in and breathe out and breathe in and breathe out and breathe out as much as you can until you've blown out all the air that you have, that is the second IRV. That is expiratory reserve volume. It's about 1.2 liters of air. So when you take everything that's in the blue here, you have got normal tidal volume. That's what you're living on, kind of breathing in and breathing out. But every once in a while, you'll take a deep breath in, and then you'll blow it out and blow it all the way out to the point where you're almost coughing. That is referred to as your vital capacity. That is the amount of air that you normally live on, and it's just under 5 liters of air. So normal tidal volume is going to be about half a liter. Breathe in, breathe out. And then if you take a deep breath in, which might be up to 3 liters of air, that's the first IRV, which is inspiratory reserve volume. And then the second IRV, once you've blown it out, you can then blow a certain amount out. And that's the tidal volume, or the vital capacity. That's the amount that you're breathing in and breathing out. That's not your total lung capacity. If you look at over here, you have about 6 liters of total lung capacity. So it's everything in the blue and some of the green. The green is referred to as the residual volume, and it's a little over a liter. That is what's going to stay in your lungs to keep you alive. The only time I can ever think of you not having that air in your lungs is when a Mack truck ran over your chest. In that particular case, you probably have gotten rid of all of your air. Just a way of thinking about it. So this is what you normally live on, breathing in, breathing out, but normally just working at tidal volume, and that's called vital capacity. And it's vital because that's the capacity that you use. You still have a little over a liter that's called the residual volume. That's going to make sure that your lungs don't collapse. One of the things that Carolina has sent you for this lab is the spirometer. So here is the bag from Carolina that you should have gotten in your box. In it is this thing. This thing is the spirometer. This is the important thing. Everything else in there you're really not going to use because when they sent it to us, it doesn't fit onto the spirometer. It's the same diameter. So if other people were going to use it, you should have this going over the mouthpiece here. So you can do whatever you want with it. They do have bags in there that you can get rid of these these cardboard things and dispose of them properly. They give you rubber bands. There's nothing you're going to be using outside of you and the spirometer. And they give it a little clip down thing so that you can hold it so that you're not grabbing it. And as you look at it, here in the center is this little yellow thing. And when I blow through this mouthpiece, it should go up. I've set mine on, I'm almost dead, somewhere in the middle to, this is the green one I've set at my capacity. So I'm sure I'm a little bit older than you, and so in the pamphlet that you get, it gives your age. I'm gonna have mine at 65, and as I go over here, I am 70 inches tall. My capacity for breathing should be 529. I know for a fact, because I've done this a couple times already, I am not up to 529. And part of that is because I've had pneumonia 3 or 4 times. But what I'm gonna do is embarrass myself by blowing through this, and the pamphlet tells you how you're supposed to do it. I'm also going to send you instructions that are really simple. Basically, you want to be sitting upright, not slumped over. You want to take as deep a breath in as possible and then blow out as quickly as possible. Like one big blowing it out like you're trying to blow out the candle. So in this particular thing, I'm going to put my lips around this and I'm going to blow through it and we'll see how far it goes. And that was actually a pretty good one. So I've set it at 529. It looks like I'm about 500. So for me, I can figure that out proportionately. 500 over 529 lets me kind of know that my lung capacity is running at about 95% of what it should be if I had everything healthy. I would assume if I had COVID virus or something like that, I wouldn't have that good of a lung capacity in addition to a temperature. So you can read through the book, the pamphlet that came with it, but this one is actually, you can keep it for yourself. There is no way for you to give it to other family members unless you duct tape it to the mouthpiece. But that's what the cardboard cylinders are for, so that you could have more than one person do it. But if you want to do it just as an example, what I'm going to ask you to do is fill in a chart as if you did have asthma. So the pamphlet tells you to do it 3 times. Take the best of those 3 times because you might giggle or something like that. Usually in a classroom setting, one of your classmates will start laughing and then you'll start laughing, then you'll start spraying and all that stuff, and that isn't going to work so well. But ideally what you want to do in one breath, blow it out as hard as you can, as fast as you can, and not keep going into the expiratory reserve volume. So this thing does slide up and down, and I was able to slide it up almost to the green. So in my particular case, that was my workout for the day. So going back to what we were doing on here, you just sitting in your chair, you are doing normal tidal volume. Breathe in, breathe out, breathe in, and repeat it. Sometimes as you took a breath in, or I took a breath in, I got all the way up to here, and as I blew it down to here, I got a measurement on the spirometer. The vital capacity is supposed to be about 4 liters, 4.8 liters, or we'll say 5 liters. And depending on your size, you may have a little bit of a larger capacity. I'm never hopefully going to utilize the residual volume at all, although my lung capacity is probably around 6 liters. Just knowing from my history, I was not going to blow it at 100%, so I'm really happy with blowing it at 95%. So one of the things that they do, and I think this is in your lab book too, they give you what the name of it is, tidal volume, and you go over to there, it's the amount of air that's inhaled or exhaled with each breath under resting conditions. One of the IRVs, the IRV, is going to be the amount of air that can be forcefully inhaled after a normal tidal volume inspiration. So on the chart, it makes a lot of sense. So we're going to breathe in, that's the light blue, and then we're going to breathe in even more to take that deep breath. So that would be IRV with the IRV. And then what we're going to do is blow it out. When we blow it out, we're going to blow out not only everything that we extra inhaled, but we're going to blow out our tidal volume that we took as we were surviving, and we're blowing it out to about here. And so that's going to be all of our inspiratory reserve volume and also all of our expiratory reserve volume. So both of the IRVs can be blown out. So that's the amount of air that can be forcefully exhaled after a normal tidal volume expiration. So a normal tidal volume expiration is kind of in, out, and then blowing out as hard and as fast as you can. And there are other spirometers that will actually measure different things. The residual volume in the green down there is the amount of air remaining in your lungs after a forced expiration or exhalation, and that is what's keeping your lungs from collapsing. By knowing any of these volumes, you can then work out the capacities. And a lot of it is just an algebraic equation. Total lung capacity is going to be tidal volume, IRV, ERV, and the residual volume. That's the total amount of air that you have in your lungs. Vital capacity is going to be tidal volume in the two IRVs. IRV, which is the amount that you can extra inhale versus tidal voluming, and expiratory reserve volume. So that's kind of what you live on. Vital capacity is what keeps you vital. And then they also have some of the other things that are in there. The chart that you're going to get with this spirometer does have it on the top for males and for the bottom for females. And all it does is ask your age, and then it asks your height. It doesn't ask your weight, which is good. So that would be everything that you would have to do for this particular lab. And I hope you have fun and stay healthy. Breathe in and repeat that frequently.